We are the place to be for topics that uplift the physical, mental, and social well-being of African American women. The program is hosted by experts and leaders in women's health and wellness, including doctors, nutritionists, community leaders, and elected officials. We provide valuable insights, guidance, and resources to help Black women make informed decisions about their health and wellness. Keep in mind that while you're going to hear valuable information about health and wellness, none of the information shared on this show should be considered medical advice. Please consult your physician before making any changes to your healthcare regimen. This show is produced by Community Hero Action Group, a nonprofit organization whose mission is to close gaps in health and wealth disparities in the Black community with innovative and trustworthy initiatives and programming like this show. To find out more about Community Hero Action Group, be sure to visit communityheropa.org. All right, family, I want to give you a heads up today that in our Speak On It segment today, we're going to be talking about some sensitive topics around sexual wellness. Our goal is to create a comfortable, respectful space where we can learn more about topics that we've been interested in knowing more about, but perhaps never had the opportunity or even felt too embarrassed to ask about. Today, we are joined by board-certified OBGYN, Dr. Sudef Lodi. We're also going to be joined by Taylor T. Muhammad of Bibashi. Lastly, we're going to be joined by Pennsylvania Representative Gina Curry for our Policy and Women's segment. So let's dive right into it and bring on our first guest, Dr. Sudef Lodi. Dr. Sudef is known as the Savvy Women's Sex Coach and is host of the Muslim Sex Podcast, where she goes into the birds, the bees, and everything in between. Dr. Lodi, can you tell us a little more about your background and what inspired you to go full force in this particular space of sexual health and wellness, and particularly with your niche in terms of a focus on Muslim women?
Yeah, absolutely. Well, first and foremost, thank you so much for having me on. I feel really honored to be here, and thank you. You know what, all the work that you're doing is so important, and I really, really appreciate the time that you're giving to this segment. So thank you for having me on. Yes, so I am a board-certified OBGYN and sex coach. I currently practice in New York, and I am a Muslim woman. I am of Pakistani descent. And the reason why I do what I do is because I felt that there was a huge void in the realm of sexual health. And oftentimes we as physicians even don't get trained in much information regarding sexual health. I'm not sure about when you went to medical school, but when I went to medical school, we had probably about like 2 to 3 hours on sexual health, and that was it. And that was in the span of 4 years. And then, at that time, when we learned about the Masters and Johnson sexual response, and that was based on research that was done in the 1960s on old white men. So we all know that, women are much different than men, and there was just not very much information or even research done on women's sexual health until recently. And in 2001, Rosemary Basson created the female sexual response cycle, which we'll talk about in a little bit, but is much different than the male sexual response. So that was very recent in itself. But the reason why I do it is because growing up, I didn't have very many role models, and I didn't have people that I could go to or ask if I had questions regarding sexual health. And so I wanted to be the resource that I never had. And my whole why as to why I even do this is to empower and educate women regarding their own sexual health so that they can have agency over it and make informed decisions about their bodies.
Well, thank you for doing that. It is very much needed, and it's like in the same way that we talk about your overall health and your mental health, physical health. This is a place where, especially for women, those two things often come together and can be really important part of someone's overall health and sense of well-being. And since it's a topic that can be sensitive, or where both men and women often don't even want to mention it. How do you make patients feel comfortable discussing the intimate details of their sexual health?
Yeah, I think that's a great question. So what I do is, as we get, typically as physicians, we'll get like the medical history, we'll get the surgical and all that kind of history when we do an intake on a patient, and so in that, I will also ask them about their sexual history, and I'll let them know that this is a safe space, the exam room is a safe space for them to ask questions, and I'll ask whether or not they're satisfied, if they have any questions or concerns about their sexual health, and then giving them the opening, where I let them know that this is a safe space, then patients will often ask about libido, they'll ask about vaginal dryness, they'll ask about decreased desire, and or any symptoms that they may be having. As you know, women, when they go through perimenopause and menopause, have so many changes that happen in their bodies. And a lot of times physicians just don't even feel comfortable talking about that. And so when we allow women to express their concerns regarding their sexuality, then they do often open up. And a lot of times what I'll do is I'll also ask them, how they feel about sex and what's the first word that comes to their mind when they think about sex. And depending on if it's a positive or a negative word, that tells you a lot about perhaps their mindset regarding sexual health. Mm-hmm. And then you can dig in a little bit deeper.
That's really important, just opening that door, even as a primary care physician, that's helpful information to me to remember to ask. But as you said, since so many of us really don't have a lot of training in how to address a problem, if we inquire about a problem that we can't do anything about, that can be an uncomfortable thing and something that your clinician might not even bring it up because they don't know what to say.
Absolutely. And, when you talk about physician-owned discomfort, it's a real thing. I mean, even as an OBGYN, we go through 4 years of training. We learn all about obstetrics. We learn about gynecology. We learn about the pathology, all the things that can go wrong, sexually transmitted infections, blah, blah. Mm-hmm. But we never talk about pleasure. We never talk about sexual health. Even most recently, I was part of an academic institution and their residents were not being taught about sexual health. So really, just like you said.
In OBGYN residency.
Yes. And just like you said, like, where are we going to get that information, right? And so I went and I got an extra training, a certificate through the University of Michigan for sexual counseling and education. It's a year-long program and where we learn about all this stuff because honestly, even if you're interested, you have to go seek it out. I mean, nobody's teaching it to you. And that's partly part of the problem, right? Is that even physicians who patients think that they should know everything, they don't.
Right. So could you explain a little bit about some of the, even though, this isn't just a conversation about dysfunction or disorders, could you explain to us a little bit about the types of sexual problems or dysfunction someone may have, whether that's, vaginismus or I think most of us know about erectile dysfunction, but maybe if you could tell us about that in terms of the women's experience.
Sure. So, two of the most common reasons why men seek out treatment with a physician is for erectile dysfunction, right? And also premature ejaculation. So those two things, men will often come to their primary care doctors and discuss those issues, perhaps even decreased libido. For women, a lot of times it's decreased libido, decreased desire. In fact, the American College of OBGYN says that about 40% of women will come into their providers and talk about decreased libido. So that's definitely decreased desire, decreased libido. Another common thing that women will address with their physicians is painful sex. As you and I know, it's called dyspareunia. And often women will experience that, and there could be so many reasons. And you and I can talk about that a little bit later on in the show, but there are tons of reasons why that might happen. But one of the main causes for that to happen is, as we go through, again, perimenopause, menopause, we have changes due to the estrogen, the progesterone, the testosterone levels that go down in our bodies. And due to that estrogen affects really everything, and so some of the symptoms that we see in menopause and perimenopause, for example, the hot flashes, the night sweats, the mood swings, are all related to decreased estrogen. The brain fog that women complain about, and they don't know, if they think there's something wrong with them, but that's actually due to, again, the decreasing estrogen that happens in our bodies, because we have estrogen receptors all throughout our body. And so that decrease in estrogen will affect so many things. Our skin, it'll result in dry skin. And one of the areas that we don't often talk about is what's called the gender urinary syndromes of menopause. And so that is when women will notice vaginal dryness. And so that can lead to painful intercourse and painful intimacy. And again, that's due to the decreased levels of estrogen that happen in our body. Other causes of painful sex can be, infections like a chronic infection. It can be due to perhaps some trauma that a patient has experienced in the past. It could be due to sexual abuse, things of that nature. So there are quite a few reasons why women may experience pain with sex. But specifically, you talked about vaginismus. And vaginismus is a condition where somebody anticipates pain with penetration. Now, it could be any type of penetration. It could be like a tampon. It could be penile vaginal intercourse. It could be a pelvic exam. It could be, sometimes I see this in women that are in labor. And so when I go to check them, they feel very uncomfortable and they experience pain with that. And a lot of times that has to do with, again, it can just be it can be fear that's been ingrained in them. And again, it can be due to trauma that perhaps they have experienced. It could be due to abuse. It could be due to sex negativity that perhaps they were raised with culturally, or that
probably a lot of it.
Right. Or that they think like sex is wrong, shameful, embarrassing, or, any of those type of negative beliefs that they may have surrounding intercourse, and they're just not comfortable. Recently, I had a patient that was actually Mormon, because, she said that it's been 3 years and she hasn't been able to consummate her wedding.
Wow.
You see that, yeah. And so that was something that was of concern to her, and she wanted to work on that during the exam that I was seeing her for. So lots of causes for why, people may experience pain with intercourse. You mentioned also erectile dysfunction, and we know that that is defined as the inability for a man to achieve and maintain a erection satisfactory enough for sexual intercourse. And they say that men, as they age, it'll become harder for them. And usually between the ages of 40 to 70, about 52% of men will experience some type of erectile dysfunction. And again, that could be due to medical conditions, diabetes. It could be due to vascular disease, for example. And you know this better than I do, since you see more men, as a gynecologist.
You don't see any.
I don't. But, we know that sometimes when men are not able to get an erection, that the vessels in the penis are one of the first ones to be clogged up, right? From cholesterol and plaque and things like that. And that might be the first sign that somebody has
cardiovascular disease.
Exactly, that they may have some type of cardiovascular disease.
So you hinted about one of the strategies for, addressing some of these issues when you kind of spoke about how many things are related to estrogen. But could you, talk about some of the strategies of dealing with these issues? And especially if I know many of our listeners might like to know if there are lifestyle things or, things that don't involve medication that could be used to get effective relief.
Absolutely. So, well, first and foremost, what I would do is I would speak to the client or the patient regarding what is their sexual dysfunction, right? And we'd go into assessing what it was and whether or not they consider it a dysfunction or not. Sometimes we, looking from the outside, may think it's a dysfunction, but the patient themselves may not think of it as a problem. True. But if they have something that they consider a sexual dysfunction, then it's important to get to the root cause. And I think that is the essence of what I do as a sex coach is trying to figure out the root cause of whatever their dysfunction is. So we may see that a patient is not able to sustain an erection, but, going back and taking a look at, well, what is it? Is it that they've had bad experiences in the past, and now they have that in their mind, and that they're thinking the whole time they're having an erection or trying to have one, they're thinking like, oh no, it's not going to happen, it's not going to happen. So those negative beliefs come into it, right? Or for example, somebody that's experienced painful intercourse or vaginismus, they're worried the whole time. There's so much in their head that they're not able to just be in the moment and experience whatever it is that they're about to experience. And so then automatically their body, their mind, it takes over. And I remember I was talking to a sexual medicine physician, and she said, and I think this is so true, is that she said our brain is our biggest sexual organ.
I've heard that.
Yes, absolutely. Because our brain controls everything. And so if we're anticipating pain, or if we're thinking that something's going to be an awful experience, or, we're already setting ourselves up. And so it will be whatever we think it is, that's what's going to happen. So
what about for women whose partners may be struggling with erectile dysfunction? Is there anything that women could do to help in that situation?
Absolutely. So I think that, a lot of times there's a couple of things. There's two things that come to mind right away. One is there's this theory or this framework that's called good enough sex, meaning like it doesn't have to be what we think it should be, right? That we should tend to focus more on pleasure than on the actual act. And when we focus on whatever is pleasurable to our partner, whether it's male or female or whatever, then we take the pressure off of ourselves, right? That performance pressure, that pressure of, say for a man, it's maintaining his erection, or for a woman, it's having vaginal penetration, or whatever it may be, just to take that off the table. So that in itself is a huge load off their mind, right? And when we focus on pleasure, when we focus on what feels good to the other person, what is it that they like? What is it that they don't like? And we do that, then that in itself will increase arousal. That's going to increase desire. That's going to change the whole narrative for somebody, so that they're not focused on the performance, but more on the pleasure, and having pleasure on both sides.
That's a really good insight about that, because, it's sort of like people who, they're brilliant people and they just can't pass standardized tests because they start to get so worked up about it that, it's sort of, they can't perform in the moment. So what do you know, what could you share with us about the relationship between sexual wellness and overall health, and certain things that are a common thread, or maybe things that one could do, lifestyle, diet, exercise, that can affect sexual function to either hinder it or to enhance?
Yeah. So what they say is that sexual health is actually a barometer of a relationship, right? And what I often say to clients and patients is that whatever is happening inside the bedroom is also happening outside of the bedroom. So how is that communication like between you and your spouse, right? Are you spending that time with each other to learn what's happening with the other person, or are you not talking at all? Do you go days without talking to your partner, right? Are you, when you're with them, when you're trying to be intimate with them, are you thinking about the laundry, the dishes, the kids, picking up food, what's going to happen, the meeting the next day, or are you really just present in the moment? There have been multiple studies that have shown that mindfulness, which I'm sure a lot of your listeners already know and probably practice, is just being in the moment without judgment, right? So what if we could do that in our own personal spaces? What if when we are with our spouse or our partner, we just focus on them and not about 50 other things? And again, that's going to increase our arousal. That's going to increase our libido. When we're being intimate with our partners, just focusing on them, focusing on the touch, focusing on the sensation of what's happening in the room, as opposed to thinking about so many other things. And there's also been studies about uneven distribution of household chores, right? And that oftentimes that lands on the woman. And so when she has so many things going on in her mind and in her life, and she's coming home from work and this and that, she's not able to focus on being intimate or having that close relationship with her partner. And being physically intimate may just be another chore, another to-do
Right.
thing on the list, right? That
Well,
she's not.
hopefully all ears are listening.
Yeah, that's right, right? So to take that off of somebody's plate, right? Sharing the chores, sharing the household responsibilities is going to really help actually in every aspect of your life, right? Because then you're going to see that the other person actually cares, that they're, also helping out, or that, you're both taking ownership of your life because it's, a family, or if you're in a family, or
Right.
however, a partnership, it shows that both of you are willing to take ownership of that responsibility and take off the load on the other person's mind. And so when you're able to do that, then you're able to focus more on your relationship. And that automatically is going to increase desire. It's going to increase your libido. And there's an author, her name is Emily Nagoski, and she wrote a book called Come As You Are. And I don't know if you've read it, but it's a very good book. And she often states that to want sex is to have sex worth wanting. So, for example, if a person is not being satisfied in a relationship, right? If they're not getting any pleasure out of that intimate moment when they're having sex, then they're not really going to want it, right?
True.
If they're not being pleased, if they're not enjoying it, then there's no reason to want it. And then again, it just becomes a chore. So if you are able to take off, whatever it is, some of the things off your list of things to do, then I think that will increase. And some of the basic things, or some of the smallest things that we can do to create that intimacy in a relationship, is just to spend time with that other person where you're not distracted. Like, put away your phones, right?
The to-do list
Maybe
is not.
yeah, maybe make a meal together. Maybe just even, if you want, watch something on the TV, just hold hands even while you're watching TV, or take a walk outside, right?
That
Do things. Yeah.
that is like really getting to the core of what probably many people need to start with. And, of course, if people need to consult with their physician, if there may be medical issues underlying it, then by all means do that. But then there are things that we can, do ourselves, like what you're talking about. So
Yeah.
we are live at the Her Health Matters radio show. I'm Dr. Sophia Shabazz, and we're at WURD Radio, 96.1 FM and 900 AM. Please call in if you have any questions for the doctor at 215-634-8065 or toll free at 866-361-0900. Dr. Lodi, I hope you can stick with us.
Yeah.
As we bring on our next guest. We're going to bring T into the conversation. Hopefully she is ready. Taylor T. Muhammad is a prevention education navigator from an organization well known to those of us here in the Philadelphia area, Bibashi. And T holds a master's in sex education, and for the last 6 years has run a business as a sexuality consultant. Welcome to the show, T.
Thank you so much for having me.
Thanks for being here. Can you tell us a little bit about yourself and Bibashi before we jump back into the conversation?
Yeah, so I have gotten my master's in sex education. My primary area of focus has been on Black sexuality and gender, especially the impact of colonization onto gender and sexuality for Black folks. And yeah, for the past 6 years, I have been an educator, self-employed educator, doing workshops on sexuality, on sex work, on gender, and particularly how that affects the Black community. And right now I have this job as a prevention navigator at Bibashi, and Bibashi is a Philadelphia-run nonprofit that kind of just hits various areas of sexual health and wellness. We have workshops that we do panels, we do, what's it called? What else do we do? A bunch of stuff. Like we have ballroom events as well for trans and gender nonconforming folks, a trans necessities closet, and we also do STD testing. And we do outreach for people who are homeless or who don't have the means to necessarily come to us. So we really try to be a safe space for a lot of trans and gender nonconforming folks in Philadelphia.
So, the remainder of the questions I was going to kind of throw out there for both of you what would you say are some of the common misconceptions about sexual health that you encounter? If you want to start, T.
Yeah, I'd love to start. So some common misconceptions I think about sexual health is that if you know about your sexual health and your sexuality, that means that you must have had an unhealthy like sexuality or you're hypersexual. If you are sexually empowered or know what you like or are more experienced and that things of the nature. I also think something that's come up after talking to my family about that question actually is that protected sex doesn't feel good. Is a huge one. And what else? I think those are the two ones that keep coming back to me
I see
often.
some nods of agreement from Dr. Sudef.
Yeah. I think that's great what you're doing, T. So yeah, some of the things with just what Taylor was saying, and I have to agree, is that, oftentimes people, they hypersexualize, right? Like if you feel very comfortable talking about sex, then they think exactly what you're saying. They think that, oh, maybe, she's loose, or at least for women, maybe she's loose because, has had tons of experience and she just really knows. And, and I will say that like, ever since I started talking about sexual health and wellness on social media, right? You get like all of those strange people like DMing you and thinking that you're, and it's just like, what the heck, like you're just trying to think about awareness for sexual health and wellness. And really you're not hypersexualizing, but they end up hypersexualizing you and eroticizing you. And that's where the problem comes in. Oftentimes also, people that have been raised in very conservative cultures, perhaps they have a lot of sex negativity. They think sex is like shameful, wrong, dirty, not something that you should talk about. And that there's, just what T was saying is that, maybe there's something wrong with you that you talk so openly about sex and that, you're just really free with it.
That I think that we've all heard or kind of seen these things, being a common thread across various cultures for various reasons. But at the same time, it's so important for just society and people's overall wellness. Would you say, or could you give any? Are there any lifestyle factors that have been shown to be more effective than others in terms of improving sexual wellness?
I don't know. T, do you want to speak first? Then I can speak after you.
No, you can go. I haven't think about that one.
Okay. All right. So for me, what I believe is that, like we were talking about before, Dr. Shabazz, is that, whatever sexual health is part of overall health. And so I feel that when you take care of your body and take care of any type of medical conditions that you may have, that's going to improve your overall sexual health. We talk about diabetes, we talk about high blood pressure, and how those medications can also affect arousal and libido. And so, for example, in high blood pressure, sometimes people are on like beta blockers, they're on calcium channel blockers and things like that, and that can mute your libido and your desire. Oftentimes also we'll talk about, in medicine, we'll talk about the biopsychosocial model, and that really comes into play when we're talking about sexual health and sexual wellness. And so when we talk about the biopsychosocial model, we talk about what's going on biologically, like, for example, any type of medical conditions, right? The psycho part of it is the mental health aspect of it. And I know that Dr. Shabazz, you had mentioned a little bit about that, but like anxiety and depression will really affect your libido. It's going to affect your arousal.
Common.
Yep. And medications, right? You and I know that medications will also affect that. And when we talk about the social aspect of it, again, we're talking about what is going on in that patient's life. Are they a single mom? Are they working like 4 jobs? Are they, what type of environment did they grow up in? What type of friends do they have that they're, associating with that are perhaps maybe bringing in that sex negativity to them? What type of experiences are they having? Are they safe when they're having intercourse? Are they focusing more on performance? Are they focused on preventing disease? So different things like that. So for me, sexual health and sexual wellness are very intimately entwined. And so I know, but,
pun not intended, but
that's right. It's so important to address all of these things so that you can see the person as a whole and to help them assess whatever it is that might be bothering them.
there was something that came to mind when you were speaking earlier about, with women, sometimes whether or not you are having enjoying an experience or experiencing pleasure is it's associated with whether or not there's lubrication, which you've explained that
Yes.
there are a lot of physical
Yes.
changes that can happen in
Yes.
women for a variety of reasons, whether that's medication or
Mhm.
perimenopause, and how that connection may not be what you think it is. Are, in terms of ways to address that,
Yeah. There's
the
time.
particular issue of lubricants,
Mhm.
are there, what are some
Yes.
of the causes, risks, and benefits of, using various types of lubricants?
Yeah. I don't know, T, if you want to, I can talk
Yeah.
about menopause and all that stuff.
Yeah,
Uh,
so I unfortunately don't know too much about menopause, but I do know that literally anything can change your lubrication. Like it is like every other part of your body. Like there are some days that, you can break out and get acne, and then there's some days that you don't. It can depend on stress. It can also be menopause when it comes to bodily changes just happening in general that you can experience dryness. Medications can give you dryness. Also not being hydrated, and that might not even be a thing of, oh, you need to drink more water. It might just be that you might have been stressed out and forgot that week or day, and then you're being blamed, because you're experiencing dryness. There are so many ways that you can experience dryness and not be wet enough. However, the thing is that lube is a great invention, the same way that condoms are, and we should be using it, or at least have it next to us during sex at all times, because it helps prevent tearing of the body as well as tearing up the condom. Sex feels better, is not as painful, you can last longer. There are so many benefits to lube. And if you're using lube with condoms and other toys like silicone toys, it's really important to use water-based lube, because silicone lube, which is another type of lube that you can use if you can use it with condoms, but I would say that if you're not using condoms, it might be even better. Silicone lube, when it comes to silicone toys, if you put those two together, they can disrupt the toy itself. Like it can degrade the toy. So water-based lube is really good when it comes to using barrier methods. So using like condoms, dental dams, insertable condoms, things of the nature. There is silicone lube that is good for self-pleasure as well as pleasure with non-silicone toys, and also having sex without barrier methods. And then there's also oil-based lube. And an oil-based lube will actually degrade the condom. So it's really important to look at what type of lube that you're using, because you don't want to be messing up the other barrier methods and the other protective measures you have there. But I will say it's something that I've realized with me when I've had long-term partners. I used to use coconut oil, and it would be really helpful to keep everything lubricated and things of the nature. So those are the type of lubes that I would recommend for sure. But lube is everyone's best friend. It's also really helpful to put in a condom sometimes. So I know a lot of people, especially I was talking to my brother earlier, and he's 20, and he's talking about like he's the one who told me that sex doesn't feel good without protection. And I was like, well, if you put a little bit of lube in the condom, it's not as tight, and therefore it can be more pleasurable, because you're feeling a little bit more sensations.
Yeah.
That's great information, because I think, and I think too, like your phrase about just like opening up that door, because I think about songs like, I don't know if it's WAP or WAP, where it's like all of a sudden it's like, oh, if you need lubrication, then there's something wrong with you. You're not a
Yeah.
whole woman if you need to, grab intervention. But yeah, there's a lot to keep in mind. I'm not too sure I had the whole rundown like you did in terms of silicone, and I think we all know oil-based condoms don't mix. But that is great. So okay, and I want you to have a chance to jump in.
Yeah, I just wanted to speak a little bit to that as well, and to kind of add to what T was saying. So there's so many different types of lube, and there's water-based, there's oil-based, there's silicone-based. So you just have to see what works for you. I know that like the water-based lubricant will sometimes dry out, so you'll need to apply more. The silicone-based tends to last the most, but again, what T was saying is you don't want to use it with silicone toys. You can use the oil-based, but the oil-based can degrade the latex condom sometimes, and then you're at risk for like STI, sexually transmitted infections and unplanned pregnancy. So those are things to remember. And there are estrogen. Having sex, then those may be important for you as well. Vaginal moisturizers are used when you want something on a consistent basis, and they're used like 2 to 3 times a week to increase that moisture and lubrication within the vagina. And if you are experiencing in menopause, a lot of times, and perimenopause, you will have vaginal dryness due to the decreased estrogen levels. And so at that point, it's definitely important to talk to your provider about perhaps a vaginal estrogen, which will help to basically increase that lubrication and the skin, that vaginal tissue. Because what happens as we get older is that our tissue, those estrogen receptors on that tissue will also be affected. And so we'll lose that elasticity in the vagina and that lubrication. And so that vaginal estrogen will help to build that up. And so that's why that's so, so important. And there are very, very limited contraindications to using vaginal estrogen. So I
was going to ask you, are there people that shouldn't?
No. In fact, because it's local, it's not systemic, it's not going throughout the whole body, and it's just a tiny dose of vaginal estrogen. It is so, so important that really, honestly, all women go on vaginal estrogen. And I really apologize. I'm using my son's computer and I think he's getting text, but anyways. So it's so important for women to use vaginal estrogen when they need it, because it will help them so much. And not only does it help with sex, but it helps to prevent recurrent UTIs in women that as we get older. So that's why it is so important to use that vaginal estrogen. So for anyone that's listening, make sure you go and speak to your provider about that, because it'll change your life. It really, really be helpful. And a little bit just to what T was talking about, is sometimes when women are whether or not they're lubricated enough. And I think that sometimes, we talk about sexual non-concordance, right? And so arousal, it's actually called arousal non-concordance. What that means is that sometimes a woman can be, let's say, lubricated or wet down below, but she's not interested in sex. Or it could be vice versa. She could be interested in sex and not be lubricated down below. And that's called arousal non-concordance. And I think that it's really important for people to understand that just because if somebody's not lubricated doesn't mean that they're not interested in sex. And that's where communication comes into play. And it's really important to talk to your partner and ask them if they want sex, if they don't want sex, and whether or not they're interested. I was just on this Facebook group and somebody mentioned that she was with her partner and she did not want sex, but because she was, wet or lubricated, whatever, he thought she wanted it. And she was really upset because the consent wasn't there. And so that's why consent is so, so important in a relationship. And just because somebody's body is responding doesn't mean that their mind is there as well.
Mm-hmm. Right. That's a really important point that you're making. And, I guess a lot of this kind of plays in or kind of helps to set the stage when we're talking about education and how I was listening to your podcast and Dr. Lodi, I think you were saying how in sexual education there really wasn't a component that had to do with, the enjoyment or pleasurable aspect of that, whereas more like the pathology of sex and how that really can be something that shuts the conversation off, or I imagine that it could. So how would you say the role of sexual education would play into promoting healthy sexual behavior and preventing infections, preventing people from maybe unwittingly engaging in non-consensual sex because they had an understanding about what it means for someone to give consent or what it means for a woman to have a physical response, but you haven't actually gotten their consent. Mm-hmm. Is education important for people?
Absolutely. So, I actually did a lot of research on this. And in our sexual counseling and education course, we talked a lot about this. So basically, every state in the United States receives federal funding for sexual education, but how they use it is really up to them. And then what ends up happening, as we see in like different states have different requirements and what's going on in all these different states, regarding sex ed, but that even in each state, not even just even when you get even more granular, even each town each municipality, they all kind of decide how they're going to teach sex ed and whether or not they're going to teach it. And if they're going to focus more on, the STIs or preventing it. So the Guttmacher Institute did research, and Guttmacher Institute is an institute that does a lot of research on abortion and sexual health and education and things like that. And so they took a survey, and what they noted was that children most often received sexual education either in school, in their community centers, or in church. And if they got it from church, it was focused mainly on abstinence. If they got it at school, it was focused a lot on prevention of STIs. And if they got it at school and at community centers, it was focused mostly on STIs. And like I said, at church, it was focused mostly on abstinence, but nobody really focused on pleasure. And so children don't know, they don't learn about that. They don't learn so much. And a lot of states do not focus on consent either. And what they also noted was that some of the sex education, depending on which state, did not even have to be medically accurate. Mm-hmm. And so there's no consensus on how sex ed is taught here in the United States. And we also have to realize that most children by the age of 11 have been exposed to pornography. So, I
experienced that with my son. He was like in second grade. I'm like, what?
Yes. And what we don't realize is that, and what the kids don't realize is that, pornography is, it's entertainment, right? Mm-hmm. And it's not reality. And that's not necessarily what happens. And, a lot of marriages can be affected if people are thinking that this is and especially in cultures that are conservative, I would say. And so then people have exposure to porn and they're not really experiencing sex on their own. And then they go into like a relationship or a marriage or whatever. And then they think that this is what my marriage is supposed to look like, right? Mm-hmm. What I see on TV, what I see in the media, this is what my sex life is supposed to look like. And if it doesn't look like that, then there's something wrong. And, we must not be doing it right. What do you think, Katie?
No, I completely agree. I mean, I think that we live in a very sex negative society, unfortunately, and we're also a melting pot, and apparently a melting pot when it comes to our education. So there's just a lot of different messages that come out there. And as someone who went to a Catholic school, I definitely received sex is bad, don't do it, abstinence is the right way. And if you do actually have sex, you're going to get herpes and chlamydia and all, again, like STI focus rather than pleasure focus. But what I realize is that people are not having, for one, good sex because we're looking at porn, and we also don't really have or teach people about porn literacy, which is something that I think that we should be teaching kids, honestly, because what's happening is that people are seeing porn as their first experience or first time seeing sex. And because there's not really any talk about the fact that it's a performance, that people are doing consent before the cameras start rolling, that there is negotiations and agreements happening before the cameras start rolling, is that we just have the act itself that's super glamorized with all these shots and all these angles that people really can't do. And that's why they're porn actors versus people having sex. You know what I mean? So I do think porn literacy is really important for people right now. But I feel like the issue with education is that when we don't have education, people are kind of just going off of what we hear, and the blind leading the blind, unfortunately, when they're teenagers, and being like, well, an example of something that I remember so vividly, it was like my friend being like, well, I'm not really having sex because I'm doing anal instead. And I'm like, yeah, you definitely are. And even then I didn't ask I'm not going to ask then, but now as an adult, I look back, I'm like, were you using condoms? Were you using good lube? How is this working? But these are real situations that happen. So the lack of education leaves people in basically to their own devices. And as kids are normally, and teenagers, are also having sex, that they often do it not the best. And I think having pleasure-focused sex can also allow people to be more empowered of how they want to do sex. There are so many ways to do sex. There's non-genital stimulation, there's kink, There's mutual masturbation if you don't want to have penetrative sex. There's so many different types of sex that kids, and when I mean kids, I mean anyone before 18 who's doing sex, that kids can do so they can get to a point where they feel, or not get to a point where they, well, what I mean is like they can become more empowered, and if they don't want to have penetrative sex, they can have different types of sex. But what's happening is that there's only sex or abstinence or herpes. So when you have a lack of choices and a lack of education, you're just kind of, again, shooting in the dark, and it's not helpful, and it's allowing a lot of people to become pregnant, to get STIs, because they're like, well, I thought if I did anal, I wasn't going to get an STI. But it's like, there's still penetrative sex. We still need to talk about it. You still need a condom, even if you're not going to get pregnant, you know? Right. So
we actually have a caller. So why don't we hop to it, because we're coming up fast on the top of the hour. We have a caller, Rick Armani. I hope I got your name right.
This is Rick calling you long distance from Germany, sis.
Oh, wow. All the way from Germany. We're international, y'all.
I just want to say, one, it is very exciting that you have a woman with a Muslim background talking about sex education, and consensual sex. And number two, I am a 56-year-old male, and I tell you from what I've seen of porn, it is not reality. What most of is put before the public, that is not reality. And if your children are into porn, get them away, get them to a professional immediately.
Right. Thank you for your comment. I think that so many people don't realize the brain is such a powerful thing, in the same way that people can become addicted to smoking or gambling or whatever. People can actually, you have a neurologic response where I've had teachers say that they have young children in their class who are kind of caught in that loop and can't break from it, and it's distracting, interfering with their education and things like that. So, it can be harmful, in the appropriate setting. It's not necessarily, have that same effect, but we're in an information society where it's like there's too much available to too many people that don't really have appropriate filters for that. So I thank you for the caller. I'm glad for his comment, and it makes it even more impactful, or I guess it brings home for me how important these conversations are, as uncomfortable as they may be for people. That it's really important that people who know what they're talking about are not giving information, and not just, whether it's a rap song or pornography or whatever else that someone might find on the internet. Mm-hmm. So, Dr. Sudef Lodi, how would our audience find out more about you and the resources that you offer, so if they wanted to, find out more?
Yeah. So I'm on social media. I'm on social media at Dr. Sudef, DRSADAF, OBGYN, on both Instagram and TikTok. And I have a podcast called the Muslim Sex Podcast. I also, you can email me at drsudef@drsudef.com, as well as go onto my website at drsudef.com. And I also have a YouTube channel that I just started, and that is Dr. Sudef Intimacy Coach. So I have a whole bunch of ways that people can reach out.
So hopefully, that people caught all of those. I think the easiest to remember, drsudef.com, right?
Yeah.
So
website,
people can track you down that way. T, same question for you. How can someone find out more about Bibashi and about the services that you offer?
Yeah, for sure. So you could go follow Bibashi online. It is Philly _Bibashi. And there's also Bibashi Plus. They're both on Instagram. We also do have a Facebook of Philly Bibashi. You can email me, or if you want to email Bibashi, it's basically just info@bibashi.org. But if you want to email me personally, because I do workshops and panels and speaking events like this, you can email me at taylorm@bibashi, and Bibashi is spelled BEBASHI.org. And I do have social media personally for myself. It is called I Hope You Learn Something, and that is spelled IHOPEYWU something. And even though it has a lot of miscellaneous stuff, I'm trying to use it again to try and spread the word a little bit better on my own personal platform. So those are all the ways that you can interact with me.
Thank you so much, both of you, for joining us today on Her Health Matters. That is going to wrap up our segment on sexual harmony. We hope that all of you listening, that you found our discussion informative and valuable. Remember, taking care of your sexual health is an important part of your overall wellness. So there's no shame in seeking help or advice when you need it. Just make sure you talk to someone who knows what they're talking about.
Yes.
If you have any questions or comments about today's segment, feel free to reach out to us. You're tuned in to Her Health Matters with me, your host, Dr. Sophia Shabazz, on WURD Radio, Black Talk Media. We're airing at 96.1 FM, 900 AM, and streaming on WURDTV.com. We're going to head into our segment, our Policy and Women segment, with Pennsylvania Representative Gina Curry, who represents the 164th Legislative District in Delaware County. She is a member of the Pennsylvania Legislative Black Caucus and the Women's Health Caucus co-chair. Is Representative Curry available? Okay. Well, I think we can, until she is available, why don't we go right into the Make Moves segment so that, if she's able to log in, we'll have a chance to speak with her. But we can share with you what's going on in our community so we can stay active and dedicated to our health and well-being until the next episode. You may have caught me, yours truly, on Fox 13 talking about the third annual health conference, which took place last week. Unfortunately, the Health in Action Festival had to be rescheduled to May 13th due to the weather forecast. So mark your calendars, and we look forward to seeing you all in person on May 13th. There will be live entertainment, food, vendors, henna painters, stilt walkers, and importantly, a Medicaid re-enrollment clinic. If you missed that segment on the health policy segment at the Black Health Matters Conference on April 18th, you can find that on the website, blackhealthpa.org. Really important Medicaid re-enrollment as of April 1st. It's not going to continue to, you won't continue to be automatically re-enrolled. You are going to have to re-enroll, or you may unexpectedly lose your Medicaid benefits. But there's going to be a ton of healthcare resources and some screenings, of course, available. So please come on down on May 13th to Vernon Park, which is at 5800 Germantown Avenue in Philadelphia. Again, that's Saturday, May 13th at Vernon Park. You can visit blackhealthpa.org for more information about the May 13th event. During this segment, we share activities and events that are taking place in the community that promote health and wellness. Community Hero will be starting a community health event page in which organizations can share their organization's events starting on May 1st. So we may not be able to fit them in all here on air, but we definitely want to highlight them on the website at communityheropa.org. Just click on the Events tab to submit your event. Lastly, as part of Community Hero Action Group's ongoing Building the Block initiative, We encourage everyone to be informed and also engaged, which means voting every 6 months. And if you haven't been watching any media, then maybe you somehow weren't aware that there is a primary election coming up. There's a primary and a general election every 6 months. There are a lot of different policies out there from candidates that indirectly and directly affect women's health and wellness. The last day to register to vote for the primary is May 1st, and the primary election is being held on May 16th, 2023. Go to votespa.gov for more information and to register to vote. The producer of this show is Community Hero Action Group, which is a 501c3 nonprofit dedicated to closing gaps in health and wealth disparities in the Black community. If you want to get involved with the work that we're doing, such as this radio show or many other initiatives, visit the website at communityheropa.org or email us at contactus@communityheropa.org. It takes all of us to get this work done. So on behalf of Her Health Matters, I'd like to thank WURD's technical producer, Rhonda Gibson, and the executive producer of Her Health Matters, Nicole Keels-McGruder, who is also the founding executive director of Community Hero Action Group. That takes us to the end of this episode of Her Health Matters. I'm your host, Dr. Sophia Shabazz, signing off until next time. Be healthy, be you, because
this program is a rebroadcast.
Did you hear the word around the community? Check out Health Partners Plan Show Live from WURD on 96.1 FM and 900 AM every fourth Sunday of the month from 5 p.m. until 6 p.m. Be sure to tune in to hear more about Health Partners Plans, community events, and information to help improve your health and your well-being. To learn more about Health Partners Plans, visit healthpartnersplans.com.
Holistic health information every weekend with Dr. Paul. Saturdays during the Holistic Hour at 9 a.m. and Sundays during the Green Hour at 3 p.m. right here on WURD 96.1 FM and 900 AM. Streaming live at wordradio.com and on the Word Radio app.
This is the story of a very special woman. In a matter of seconds, she turned herself into a great mathematician or an entrepreneur. Her knowledge was limitless, and still is. She could also make monsters disappear, especially those that lurked in the shadows under the bed. Once, this woman put back together a teenage girl's broken heart, which had been shattered in 1,000 pieces, just by giving her a bear hug. She masqueraded as a regular person at work, but as